It gives me great pleasure to introduce my good friend and colleague, Dr. Tarek El-Bialy. Tarek really doesn't need an introduction when it comes to the world of orthodontics, particularly clear aligners. He's one of the number one Invisalign users. I've seen him so many times at the World Summits. He always wins best presented cases. I follow him on Facebook where he shows amazing cases that I would think needed surgery, needed numerous extractions, needed all this, and he's done it all with aligners. So Tarek is a full professor, University of Alberta, adjunct professor, University of Manitoba. He's actually published 166 articles in peer-reviewed journals, three textbooks, one of which I recommend when I teach clear aligner therapy myself, and that's on the biomechanics with clear aligners. He has 3 patents and 15 book chapters. But on top of that, other than purely being in an academic role, Tarek runs a very successful practice called Sphinx or Orthodontics. And today I've asked Tarek to share with us some of his insights into clear aligner treatment planning and biomechanics to get the job done. And Tarek, as I was saying earlier, one of the problems we have in Australia, in fact, I think all around the world, too many people are being reliant on AI, and when they get their ClinCheck back from whichever company it may be, they don't really know how to modify it, and they just assume how the computer moves the teeth is how their teeth are going to end up. And so we end up with unhappy patients who've had promised 18 months of treatment, now 3 years, no closer to finishing, more refinements. And I think when I've seen your planning, you really understand, of course, with your dual PhD, your biomechanics is your forefront. So I'll hand over to you. Thanks again for doing this. I know it's your Saturday evening, and we really appreciate your time.
Thank you very much, Derek. And I'm looking forward to it. I can't wait to see you again and see your group in Australia. So, what I'm going to go over the highlights of this advanced aligner training in Australia, the AEODO teaching facility directed by you, Dr. Mahoney. So I'm going to go over a very important part. So how to use the AI in diagnosis and treatment planning. So one part of the new introduction from online technology, but this can be used by some other companies too. I'm not sure if other companies provide this, but one of the most important things that they have introduced recently is the outcome simulation. And with the outcome simulation, you actually can modify like a diagnostic setup and then share with the patients. And you can tell the patient, yes, we can do upper lateral buildups, we can do lower IPR, we can do combination. And then the Simulation Pro, basically, which covers like the incisors as a mock-up of like a digital smile design, for example, for build-ups. And they have this as well as part of the Smile Architect. But one of the most important introduction recently is the video simulation. With the video simulation, you can look at the patients when they smile and then when they talk, and then you can actually diagnose some important problems like tongue thrust, some mannerisms, occlusal mannerism, facial mannerism that the patient do all the time. And with those occlusal mannerisms or facial mannerisms like tongue thrust, things that you cannot or may not be actually able to catch it during the clinical diagnosis of the patients. And then it can cause like canted occlusal plane forever. You try to fix it by many aligners, many refinements, and nothing had happened. Even with fixed appliance, I've seen cases treated by fixed appliances twice, and jaw surgeon, everything failed simply because tongue posture, tongue tie was not addressed, for example, or low tongue posture. So with the video simulation, you can actually see if the patient has any of those ones. And then this is part of the Smile Architect that was introduced by Align Technology a few years ago. And it's like a combination of digital smile design like veneers of the incisors, for example, and aligners at the same time. And then you can go back and forth between the smile design and how much you need to intrude upper and lower or lower incisors. So the dentist, or if you can do build-ups or veneers for the patient, you have an idea how much space you need, and then you can design that into your ClinCheck or digital tooth movement. The other thing that has been introduced in the last couple of years, which is the IPE, which is Invisalign Palatal Expanders. The Invisalign Palatal Expander, it can produce skeletal or dental effect, depends on how you use it. So I'll go over those many cases that I have done for cases from 8, 9 years old up till 52 years old. I've used it up till 52 years old patients with very great success. And then we're going to give you some hints and tips how you actually from the get-go you can achieve skeletal changes even in adults or only dental effects. So I don't rely on hand wrist x-rays anymore or those cervical things. I only rely on the patient's own anatomy from the CBCT, and I'll give all of that to you once we get started. So how to use the AI in diagnosis and treatment planning. So there is two softwares that I use mainly in my office. One is the Dolphin software, and it can provide a growth simulation for up till 20 years. Very predictable of the same patients when they are growing. So you can actually treatment plan the patients according to their own growth prediction or growth amount that's predicted by their genes. With that, I can redirect the growth from backward to forward in class 2, from forward to backward in class 3, for example. If you don't have that software, there is another software that's available that can do the same thing for you and can provide you with detailed treatment planning. And it's like about $5 per case, which is nothing. But you need to work a little bit around it. We'll give you some sort of a trial. You can all the participants can scan this QR code and then can play with it, and it's actually very helpful because it can give you as a clinician some roadmap of each patient individually based on more than 5,000 cases from rickets records that have been used by University of Illinois Chicago. So there are two main differences. Is we have some limitations on how much we can expand the jaw. For example, even if you are using Damon wires, Damon system, or other systems are out there, you may not be able to expand the arches as much as you want. However, with aligners, we'll show you how you can expand cases as much as you can. According to Haas, the limitation of expanding the upper arch is the chronoid process of the mandible, for example. And then we'll go over how to take advantages of the occlusal coverage of aligners. Like occlusal coverage of the aligners can help facilitate sagittal correction. For example, you can start class 2 correction from day 1 if you want to. With the fixed appliance, you have to wait until you are in 1825 stainless steel arch wires in order to initiate class. But with aligners, you can start from day 1. It also eliminates interferences, so you can fix anterior and posterior cross bites immediately. And it works as a functional appliance. I discovered by accident that wearing aligners can work as a functional appliance. And if it does so, then you don't have to overkill yourself and your patient by complex devices like Herbst appliance, for example, Mara, or all those, or headgear, all those kind of stuff. And also it can provide you differential anchorage. Differential anchorage means that you can actually use the aligners. If you choose to do extraction, for example, you can do maximum anchorage without any headgears, without any TADs, and you can do moderate or minimum anchorage. We'll show you all of those cases once we get there. And also you can set up the cases from the up. There is any non-tracking, for example, you can easily detect it and you can mitigate it right away. So with clear aligner, we can treat all types of cases from moderate to severe crowding with different types of cases. This is a case, for example, came to me and a mom was expecting to tell her for premolar extraction. Upper canines were totally blocked, lower fours, first premolars totally blocked. And you can see within 16 months in treatment, all the teeth were inside the dental arches, including second molars. And then 22 months total treatment time, only one refinement, and that was it for this patient, for example. No more than one refinement. That's another case, for example. You can see this is a 22-year-old, sorry, 22 months, and a 30-year-old female. She was told extraction by everybody in town. We'll go over early treatments. Why early treatment is very important? Because early treatment is one of the concepts that's very important to prevent any cases to become more complex or surgery, for example. How can we use different types of aligner product, like with Invisalign, for example? There is Invisalign Child, there is IPE or Invisalign Palatal Expander, and how to avoid unnecessary long treatments in two-phase treatments. I'm going to also talk about the EVO system, the ultrasound device that can facilitate tooth movement. This is a case, for example, with minor crowding, but high angle case. So we had to expand with this IPE. You can see we've got very, very bodily movement at the crown and the root level, for example. That's another case, increased overjet, increased deep overbite. And in 1 year difference, she was done. 1 year, phase one was done using the IPE and aligners. So you can see beautiful results very fast, and you don't have to have the patients burned out by 7, 8 years in treatment. For example, if you do phase one into phase two, phase one, finished problems, major problems are done. And then after that, give the patient retainer, keep seeing them until all adult teeth grow in every 6 months or so. And then once they're ready for phase two, if they need to, then you go for it. With deep bite, we all know deep bite is one of the challenging cases, especially when it comes to clear aligners. Coastal jaw surgery, none of that. 7 months with AVO system and aligners, she was done. Beautiful results from here to here in just 7 months. No refinement, no additional aligners, just straightforward from one set of aligners. That's another case, totally blocked out 2, 3 upper left canine, and totally blocked out lower lateral incisor 3, 2. And you can see 19 months treatment, only one refinement for this case. And then the deep overbite, the crowding, everything was fixed, just aligners, nothing else. And then we'll discuss about mechanics of open bite. Open bite is very, very challenging, especially if there is a tongue tie, if there is anterior tongue thrust. All those basically we'll discuss how to diagnose them from the first place, and then how to arm yourself with tools that can facilitate the results and makes the impossible cases or surgical cases can be treated non-surgery, for example. This case was told surgery many times, have been having few orthodontic treatments for years, and everything failed, and he start to hate to hear orthodontics. So within 6 months, we managed to get his front teeth to bite together, and he was able to chew properly. That's a case where it's on my social media, a very narrow upper arch, very narrow lower crowding with tongue ties. You can see the teeth are all aligned. That's amount of expansion I'm talking about with aligners that it's very almost impossible to achieve with fixed uplines, for example. So huge improvement in this case with just aligners and a system at my office. And then when we're going to talk about class two cases, so there are lots of debates in the literature about class two treatment. If you Google class two malocclusion, probably thousands of articles will come. But the problems with the class two, you cannot use one protocol for all of them. So There are different types of subtypes of class 2 from the skeletal point of view and from the dental point and relationship of upper and lower jaws relative to the anterocranial base. And when you add also the brachyfacial, mesophacial, and dolichofacial type cases, when you add all of those two subtypes, I ended by calculating 126 subtypes of class 2, 126 subtypes of class 2. They cannot be all treated by headgear. They cannot all be treated by functional appliances. They cannot all treated by class 2 elastics. So differential diagnosis is very important. We'll go over that. McNamara, this is James McNamara at the last AAO together. And according to him, about 80% of class 2 cases are actually due to mandibular retrognathia, not maxillary prognathism. So I'll show you a case that a full step class 2, 11 millimeters of overjet, just 15 months in treatment, he was done. No refinement, no mid-course correction, no additional liners, of course, non-extraction, and no headgears or no surgery. And then that's another young lady, 12 months in treatment. And you can see a huge difference in this patient profile, but just how to design the case. And as I mentioned, no refinement, no additional liners, straightforward. Another case, late adolescent, a son of a dentist who was told by everybody in town jaw surgery after failed initial orthodontic treatment. And you can see non-surgical treatment with the ultrasound, with the aligners and AVO system as well. But we confirmed that this patient's mandible grew 4.5 millimeter at the condyle and about 6 millimeters total from the condyle to the pogonian, for example. Initial growth prediction show not promising growth potential for this mandible, but after treatment, you can see the mandible grown really, really nice without any functional shift. Not only in growing kids, but also I'm going to show you huge improvement in the patient's skeletal class 2 by bringing the mandible forward without any surgery, for example. And not only 30 years, but this is a 55-year-old 55-year-old female with severe skeletal class 2 managed to bring her mandible forward about 3-4 millimeters, expand her upper arch without any surgery, just aligners. So with class 3, we're going to go over different protocols for class 3 because not all class 3s are also the same, like the low angle, different from high angle cases. But I'm going to show you very, very difficult cases and how you can treat all of them with confidence. And you can see the results that's happening without any hiccups. And how to use different products like IPE, for example, the Invisalign Palatal Expander. If you believe in reversible headgear or if you want to use it, you are more than welcome to use it with a reversible headgear, the Invisalign Palatal Expander, for example. And this is a adult case here. I'll show you in the next slide here. 15 months in treatment, non-surgical, non-extraction of a patient like a 30-year-old, anterior posterior cross bites and anterior open bite, full step class 3, and non-surgical, non-extraction, and only one refinement for this patient. 15 months, beautiful results. And then we'll go over the impossible cases, that's basically the multidisciplinary cases, and including smile architects. So this is a patient has severe attrition of the incisors. No way you can actually use any brackets on any of these teeth. There is no much enamel left on the front teeth or even the posterior teeth to put any mini brackets on them. So you have to be creative. We'll show you how this case was done nicely in combination with an excellent dentist to do good build-ups and then get final results. That's another case. 20 months in treatment, skeletal class 2, severe attrition of the incisors, and was done nicely in a combination with working how to build the incisors and open the space for those build-ups. And then we'll also cover TMD cases. Cases with TMD problems, they're problematic. Even orthodontists, they always try to stay away from those cases simply because they're high maintenance cases. They will show up in your office every single day with different complaint every single day. So how to stabilize the cases and how to finish them in almost as short as 7 months in treatment. 7 months and you're done. No headaches after that for you or for the patients. And then we'll talk about surgery. Some cases they need orthodontic surgery. What are the criteria to do surgery in some of the cases? This case has protruded even with genioplasty, it didn't work. So we managed to get him a surgical setup with some TADs with aligners only. And we're going to show you how we can actually do all the setup for a surgical cases like this. And then how he finished. This is pre-surgical records when we created a very good overjet, maximum anchorage for this patient, and then immediately after bimaxillary surgery. So all was done by aligners, as you can see, and then at the end, the surgery came to advance the maxilla and the mandible, and he was able to breathe at the end of this. You can see if you look at the face superposition here, the mandible came forward an inch, and now he can sleep without a sleep app machine or any all of those other machines. And then if someone doesn't want surgery, we still can do that for them too. So this is a patient that has a growing class 3, for example, and brachyfacial type, strong chin, lots of spaces and want to close the spaces. The default in any clear aligner companies is to close the spaces by retracting upper and lower incisors. So we managed to move the posterior teeth forwards to close the spaces, not the upper incisors backward. Okay, and this maintains very nice profile for this patient. And you can see by working around the moment to force ratio, as I'm only aligners, okay, no TADs, no reverse ball head gear. So we managed to move all the posterior teeth forward and close all the spaces. So many cases, basically, they have failures. So failure is existing in orthodontics mainly because of misdiagnosis of problems, some problems. We'll show you some of those failed cases, either with braces or with Invisalign as well. And we're going to go over why those cases failed in the first place and how we mitigated them, how we improve them. So, and also we're going to cover how to treat impacted canine, impacted upper palatal canine nicely to the arch and expanding the arch in a class 3 case, for example. Lower premolar impaction, lower canine impaction. We'll go over all of those together. And then we'll finish up how you can actually build up a very good business with Invisalign or any other clear company as long as basically utilize those products wisely and you know how to use them. So you can differentiate yourself from other competitors, number one. Number two, patients will love you because nobody likes braces. Everybody wants to get clear aligners these days. And if you can treat their cases with clear aligners, why not? And especially avoid surgery and avoid extraction and avoid head gears, avoid reverse ball head gear. So why not? Hierarchy or the increasing bills of clear aligner company, you still can get a very good discount when you do big volume, but also you can finish those cases very, very fast. I showed you 7 months treatment of impinging deep overbite, 6 months improvement of open bite, 15, 18 months treatment of very, very complex cases like a severe skeletal class 2, severe skeletal class 3 as well, not only in growing kids, but also in adults. So we'll go over how you run your business, especially with clear aligners. And I'll use my office as an example, how my collections and also profit make very good profits out of your business. And this is just my office statistics to show you no matter how much the Invisalign expenses increase, I still get more revenues and also get more profitable as well. And it's just the hierarchy of my office. So I hope everybody will be joining us. And at the end, we'll give you uh, a copy, a gift as a gift from me. So we'll get you a QR code to scan it. Once you scan it, you can download a copy of my book, digital copy, and you can enjoy reading it as well. So, Dr. Mahoney, do you have any question for me?
Thank you, Tarek. That was really amazing cases. As I said, I know a lot of people will be very interested to come and listen to you. You have 2 full days to go through all of those biomechanics for those cases. There is just one a quick question. In severe deep bites, what are your tips with aligners for lower incisor intrusion?
So the first thing with lower incisor intrusion, we have to do a few things at the same time. Even in class 2 cases, even if the patient has deep bite combined with class 2 diff 2, for example, I start off by short class 3 elastics, short class 3 elastics, like a crossbite extrusion as my anchorage to intrude the lower incisors. Very, very predictable this way. But when I use the elastics, I don't touch the canine. I don't touch the incisors. So only between the lower first premolars and upper sixes. So this way I get more vertical vector of the class 3, and this helps a lot with my anchorage in order to predictably intrude lower incisors.
Perfect.
And also, I use attachments, rectangular attachments on the lower incisors. So it depends on the case, but mostly I use attachments on the lower incisors.
And then for your class 2 cases where the mandible needs to come forward, you showed an excellent surgical case. What are your thoughts on the twin block type aligners that have the ramps? Are you having much success? Any tips on that?
Absolutely. For those cases, we got to do lower incisor intrusion before we start to those blocks because those blocks they intrude posterior teeth a lot, and then most cases they end up by having big posterior combine. But when you intrude the lower incisors, the mandible automatically comes forward after you use the blocks because the blocks intrude the posterior teeth. Once the posterior teeth are intruded, the mandible automatically is free to come forward without any anterior interference.
Perfect. Well, thank you so much for your time. I appreciate you doing this on a Saturday evening, and
Thank you.
we're all looking forward to greeting you back in Australia. Thank you very much
Oh,
for your
perfect.
time.
My pleasure. Thanks, Derek. Have a good
Bye
way
bye.
rest of the
Bye.
weekend.